Hello, I'm Dr. Manish Patel, orthopedic surgeon, and I want to explain to you what a total knee replacement is. A total knee replacement is when the arthritis around the femur, the tibia, and the kneecap are removed and a complete knee replacement is done. After the surgery, a patient who's undergone a total knee replacement will have a metal implant in the tibia and on the femur and a plastic in a position in between an artificial kneecap. That consists of basically a complete total knee replacement. So when the patients move their knee back and forth, instead of the arthritis rubbing against each other, now you have a metal implant that protects the bone and prevents pain. So first I'm going to explain what the traditional knee replacement entails. The traditional knee replacement entails an incision on the front of the knee, and then after the knee incision is made on the skin, the surgeon typically will cut the muscles, which are all along the side here, and the tendon. So he or she will take a scalpel and cut all this off in order to get the exposure to go behind the kneecap. After the muscle and the tendon are completely cut, the surgeon will then move everything out of the way and do the complete knee replacement. So in the traditional knee replacement, this tendon, which is the quadriceps tendon, and all the muscles, which are the VMO muscles, are split off of the main area. So after the incision in the skin is made, the surgeon typically will cut this muscle completely off to the side in order to get better exposure for the kneecap and for the joint itself. So imagine after the surgery is done in the traditional knee replacement, stitches are placed along here to repair this cut muscle and tendon back down. After the surgery is done and the patient is asked to bend the knee, look what happens to the muscle. Imagine if this was stitched back here and this is being pulled, how much discomfort you can get. With a Jiffy Knee, there's no cutting of this tendon or the muscle, so when you bend the knee, you don't have to worry about having this muscle and tendon being stretched out and be under tension with stitches placed. In a Jiffy Knee, which is what I perform, there's no cutting of this muscle or the tendon. And so my incision, instead of going completely straight across in front of the knee, I actually make an incision, which is an oblique incision off to the side. By doing that, all the muscle that is covering the knee and the tendon are not cut. So rather than cutting the tendon going across here like most surgeons are doing, I will actually take special instrumentations and slide the muscle and the tendon out of the way. And then after the knee replacement is done, the muscle and tendon are slid back into position, and all I have to do is close the incision on the skin in a small area of the capsule. I do not have to replace or repair this tendon in here. And by doing that, patients after the knee replacement, when they bend their knee, if you can see how much tension that muscle and tendon is under, with a Jiffy Knee, patients don't have to worry about having stitches placed that the muscle and tendon were repaired with and having pain. So when my patients have a Jiffy Knee and they bend, there's no tension at the repair of the muscle or tendon because it was never cut. But if this muscle or tendon is cut during the traditional knee, then when you bend the knee, this is what happens, and this will create a significant amount of pain in the front of the knee and also delay the rehab. So that is the difference between a Jiffy Knee and the traditional knee.